we have so many drug prevention, education, treatment efforts going on. We didn't necessarily change policy for this. What unfortunately the tragedies in Long Beach recently have allowed us to get into a new community that we haven't really been able to get into before, get a lot of participation and get our message out. So I can tell you about some of the programs, but the fact that we're getting them out there is really terrific. And probably the main one, I would say, and then we'll talk about other things, but the main one is the Narcan training. In middle of 2012, we became, Nassau County, the county executive Mangano allowed us to become the first county, actually, outside of New York City, in the state to do this overdose prevention training program, life-saving program, without, that trains ordinary citizens to administer this life-saving antidote. It's it comes in a nasal spray. It's easy to do. I'll show it to you how it works, and it can reverse the fatal effects of an opioid overdose. So that would include heroin and any of the prescription painkillers, oxycodone and Vicodin and those things. So we're really lucky. 16 other states were doing it, but we're really lucky that this county executive was willing to. I did a lot of research on it, but him being willing to sort of go out on a big limb for this, and our overall opiate related overdose deaths are down 23% from 2012 to 2013. Now listen, one is too many. I mean, especially if you're the parent or a spouse or, a loved one of the people, one is too many, but we're going in the right direction. We've trained nearly 1,200 ordinary citizens so far. We had been holding trainings once a month. Now we have 4 coming up. We organized one just in Long Beach, in light of the efforts there. And then Belmore Merrick is one of the first schools that's going to have us in to train their staff, which is great. And then we'll be at East Rockaway, which is a reschedule, but we'll be training their staff too. Athletic directors, coaches, these are all people that should have it. And it took us a while to get into school, so I'm really glad we did. Anybody can do this. The training is 60 to 90 minutes. You get anybody over the age of 18 who's trained gets a little certificate and a prescription, because you need to have a prescription with it, and a free kit. The kits come from the State Health Department. Actually, the AIDS Institute of the State Health Department, and we kept getting them free. And it's, people don't know. And part of the training, by the way, is realizing what certain drugs do to the body and what an opiate overdose looks like, and the fact that it could take 1 to 3 hours to die of an overdose. I didn't know that. 1 to 3 hours. And there's also a big part about the 911 Good Samaritan law. Because, I just believe that so many of the 119 people died, Nassau County residents, last year. I believe some of them could have been saved, possibly. A lot of them died, at home. And the 911 Good Samaritan law basically says that if you're getting high with somebody and that person starts to overdose, you can call 911 to get help for this other person without fear of being arrested. Unless you're a dealer and you have an inordinate amount of drugs on you, if you're using with this person, getting high with this person, dial 911, you won't get into trouble, and help them. The kit comes in one of these great blue packages. There is a syringe intramuscular kit, but we don't use that in Nassau County. We just use the nasal. It comes with the gloves just in case. It comes with a little safety mask if you for rescue breathing, a face shield in case you come across a stranger really, and we've had that happen where somebody has found a stranger slumped over the wheel of a car and administered to them. So if you try rescue breathing, you have that. And in this box are the three components of the Narcan nasal spray. This is the liquid itself, and this is the atomizer and how it's administered. You just need to take out these three caps, two on there, one on the vial, and then there's a little needle there that will puncture what it needs to in here to start the medicine. And then you just take this piece and give it one little turn there, and here you have your nasal Narcan. You're just going to do one squirt in one nostril and one in the other. Even if the person has stopped breathing, it will still work. It'll get absorbed into the mucous membranes. The best thing about Narcan, as the last thing, is it can't hurt you. If it happens that you're overdosing on something other than an opioid, maybe cocaine or alcohol, it just won't hurt you, but it won't save you either. The person is pretty much thrown into active withdrawal when you do this. So they might not wake up, happy and calm and everything, but they'll wake up. It's been on our ambulances for years, but only AMTs were allowed to do it, and now EMTs are. So we're really happy about that, and we're going to continue going on and saving lives. Right now, we're offering it to everybody, to the public. The state was doing a sort of a separate pilot program for all EMTs, and that's actually gone. The pilot program was very successful. Both Suffolk and Nassau did it, and now it's an actual program that's no longer a pilot, and so they're all being trained sort of separately. But to use the nasal Narcan as well. We give it out to whoever. You don't have to have any training. We do train the workers in the agencies that the county contracts with. We've done that. We contract with, I think, like 29, that's school districts. I don't know, 32 substance abuse treatment agencies. And we do train them, but mostly it's for the public. Now you can get it in other countries. Like I think even France has had it by prescription, since a long time. And we're hoping that becomes the case here, because I know of some pharmacists that would definitely carry it. And it's about $20 a kit. I would think that a parent or a loved one of somebody that's addicted to pain pills or heroin would be $20 very well spent to have this in the house. So we encourage everybody to do it. The easiest, we talk about this in the training, the easiest time, the time that you're most likely to die from an overdose is A, if you've overdosed before, and B, if you've had some time of abstinence, some time away from the heroin, and your body has lost its tolerance to it, and you think you could do the same amount as when you stopped, and you relapse, you're at a much higher probability of fatal overdose. And that we've seen that, you get out of treatment and you relapse, and you die, you get out of jail. We've seen that a lot. I think it's great that the community is getting together. We need that. We need that in every community. There needs to be these coalitions kind of getting together to do stuff. You can't have too much stuff out there. It's unfortunate that it takes a tragedy to kind of set these things off, but it does. Like our prescription drug abuse committee came about right after that first pharmacy shooting. Sometimes it takes that. The biggest obstacle that we come across while we're trying to do these drug awareness, overdose prevention trainings is denial on the part of a lot of people, that it's not here in my community. It's in that community. It's in the others. It's not. When I was a kid, when I was young, the heroin addict, the picture of the heroin addict was the bum lying in the gutter, the unemployed, unshowered, and now it's our honor students and our NISMA participants, and there's just been too many. People have to realize it's in every community. We're beginning to track and map overdoses, at drug sales, and all of that. Our intel in our police department is starting to do that. I'm getting some of those. And while it's definitely in every community, there are some communities where it's much higher than others. I don't have the statistics from the villages or the city police departments right now, but in Nassau County, for the rest of it, the ones with the highest incidence of overdoses, not necessarily fatal, but all overdoses, is Massapequa, Hicksville, and Levittown. You know,
It's a democratic disease.
yeah, it must be. It must be. But yeah, so, I mean, we know that now. We know that it's generally 80% white males between the ages of 21 and 30. That's the group that's overdosing the most. I just think there's just still so much denial. I mean, even people that are in it, even people whose, children are addicted, and they've even started, going to programs and stuff. It's a lifelong thing, and they still, I think it's because they don't understand the disease of addiction so much. So they'll think, oh, he's cured, he's doing so much better now, he's not going to do that anymore. And, it's a disease like any other. It just has a stigma that, I mean, if the person had diabetes, doctors would be all over it, and everybody would be like, oh, we can do this and this, and the disease of addiction isn't responded to the same way.